How does your blood pressure increase your risk of developing dementia in the future? So basically, high blood pressure means that inside your blood vessels, the pressure is high, and that includes the blood vessels in the brain, and that changes, that can damage the blood vessels in the brain and change the blood flow within your brain and increase your risk of forming dementia, unfortunately. And so, making sure that your blood pressure, hopefully, we can do things to prevent developing high blood pressure. But if you do develop high blood pressure, it's important that it's well controlled. And that can help decrease your risk of dementia significantly. Obviously, you can't change your genetic factors that might predispose you to dementia, but high blood pressure is one of the risk factors. That making sure your blood pressure is controlled can really make a difference. And so, normal blood pressure is considered less than 120 over 80. And if your blood pressure is over 130 over 80, that's generally the point at which you would need some intervention. Your doctor may start medication. Usually you would try for about 6 months to see if you could lower it on your own. And so the best ways to do that, on your own is for most people, that includes exercising regularly, eating fruits and vegetables, not smoking. A lot of times you may need to decrease your alcohol intake depending on what it is. Usually, one glass for women and two glasses for men per day is usually the maximum. And then also making sure you get high quality sleep. So it has to be enough sleep and high quality, as well as controlling your stress. And then, if you eat too much salt, you can decrease your sodium intake and make sure you're getting enough potassium, which, if you eat a lot of fruits and vegetables, you should get enough potassium. But some people need additional supplements. And I did make other videos on that. But controlling your blood pressure is definitely possible. And, if it's not too high, you may even be able to, naturally get it back into a normal range by yourself. If not, then the recommendation is that you would start medication if it's staying over, it's 130 over 80 or higher.